keeping in mind that there would probably be a lot of different levels of expertise in the audience. I don't know if we have maybe trainees as well as faculty, people who have peer reviewed before, people who haven't. So since this is our first time doing this is going to be a really basic foundational overview, key points and nuances that are helpful to people at all levels. And also, especially since it's a pretty small group, please feel free to jump in with questions or comments at any time. I'll go through a little bit of what our history of our peer review academy, a couple that I'm involved in, and how those work. But I'm used to giving these sessions largely to smaller groups where it's more of a conversation back and forth. And so I welcome if anyone has questions throughout to just kind of jump in and interrupt me, and hopefully I can answer your questions. So these are mini disclosures largely related to the fact that I have a lot of editorial roles. The way that I got involved with peer review education was back in 2020. Let me back up a second. I'm Libby Weaver. I'm an assistant professor of vascular surgery at the University of Utah. I have been at University of Utah for just a few months. I was at the University of Virginia faculty before, but back in 2020, I was still a fellow in vascular surgery, and our specialty sort of famously published this manuscript that made international headlines, not just in healthcare, but in the public too, of how could this manuscript possibly get past the peer review process. And it made me think a lot about the peer review process in general in surgical literature and scientific literature, and think about the fact that the way most people get into peer review and our peer reviewers is just by getting asked to do it with no training, no education, and just doing and learning. And I realized there really aren't a lot of educational opportunities for how to peer review in a high quality way, in an unbiased way, et cetera. So this made me really interested in peer review. I ultimately started what we call the Peer Review Academy with a colleague of mine, Dr. Caitlin Hicks, who's now co-editor in chief of the journal Surgery. But we have been running for 4 years now this peer review academy that teaches general surgery residents how to do peer review, mostly in the United States, although we do have some international participants as well. We limit it to 10 to 12 per year so that it's a really small group classroom type of thing. And it's a course that goes out on throughout the year with mentored peer review opportunities. The journal Surgery has now opened up a similar peer review academy for faculty, and I think that that's open to anyone to apply to for those of you maybe interested in doing something a little more sort of directly mentored like that in the future. I don't remember what time of year they put out their applications, but I think they're about halfway through their current cohort year right now. So I would say in the fall, look for applications for that. I also hold several associate editor roles, both for the journal Surgery and for a journal associated with the Association of Surgical Education, as well as for some of our educational content, V-Score, something we use here with our vascular surgery residents in the United States. And then I'm on several editorial boards and so forth. So my perspective for what I'm going to be talking to you all about today is both as an editor, but also as someone who does a lot of peer review and as someone who writes a lot of scientific literature and receives that peer review, and how to think about, the peer review process from all of those perspectives and how you can make it helpful to everyone involved. So these are the objectives for today. Essentially, we're just going to go through sort of the basics of why to peer review, things to think about before you commit to it, and then how to approach your peer review in a high quality manner. And then I also want to touch a little bit on how to get more involved in the peer review process and what that can ultimately lead to for those of you who may be interested in having an editorial board role on a journal or things like that. There are some sort of tips and tricks for how to get more involved with the peer review process, which is sort of the necessary step to getting to those editorial roles. I just want to thank the three physicians here on the slide too, Dr. Hicks, Kanata, and Kim. Mostly these are my own slides, but I did borrow a couple slides here and there from a talk that they put together for their surgery peer review academy. So thank you to them. So what is peer review? Peer review actually can refer to a lot of things in surgery, but what we're talking about today is scientific peer review of the scientific literature. So it's part of the editorial peer review process. It's intended to maintain quality and integrity of our scientific literature by allowing a set of referees, so to speak, usually 2 or 3 for most journals, with various backgrounds and perspectives to appraise the content being considered for publication. Why do we need to know how to do this? So there are a lot of reasons why I think it's important to be involved with peer review. One is just, for me, is just citizenship. I think about every paper that I submit to a journal, that means that 3 reviewers are reviewing it for me. And that's assuming it gets accepted at that journal. If I have to submit it to 3 journals to get accepted, maybe there are 9 reviewers looking at my paper. So I think about, well, if I expect others to do that for my work, I feel like I should give back to the journals as well and do those peer reviews for other authors. That's kind of how I see it. But also, it's a really wonderful learning opportunity. The more I peer review, the better writer I become, because I start looking at manuscripts from this perspective of like an outsider who's trying to critique the manuscript in a way. And it has really enhanced my own writing abilities. Also, I will get to review papers that are new analyses or new findings that are not in the literature at all yet. And so sometimes I'm the first to know about sort of big, data analyses that become important things in our clinical practice. And it's really fun, honestly, to be one of the first to know about these things and to be able to apply it to my own practice early. In the United States, we have to do some continuing medical education to maintain our board certification. I admittedly don't know the international trends in this, but at least in the United States, you can get credit toward your board certification maintenance for these reviews. It is, as I mentioned earlier, a necessary step in the pathway to editorial leadership if you are interested in being on an editorial board or having editorial leadership in a journal. And for me, some of the stuff I review is way more sort of scientifically robust than I personally have the skill set to do, even though I can understand it and appreciate the strengths and limitations. I maybe don't have the skill set to actually do such an analysis or have the patience to do patient practice to do such an analysis. And so I feel like as a peer reviewer, if I'm contributing in a constructive way to a paper, I'm actually contributing to the literature through that mechanism as well. So I think that's also an exciting reason to be involved with peer review. And this is not a reason to do peer review, but just as a side effect of it. A lot of times, if you're a really good reviewer, you will get asked to do some invited commentaries on some of these papers. Maybe you had an opposing view of the authors or thought there was a really large limitation to the paper that you talk about in your review, and the editors want to highlight that. They may ask you to do a commentary about it, or maybe it's just a really great paper and they want someone to sort of bring extra awareness to the paper, so they'll have an invited commentary. And almost always they ask one of the peer reviewers to do that commentary. So it's a way to get a platform to publish yourself, even if it's not a scientific paper. There are many types of peer review, but the 2 most common, at least in surgical journals, are single-blinded or double-blinded. I would say probably moving to about a 50-50 in terms of who uses these 2 strategies, but single-blinded just means that the authors are blinded to who the peer reviewers are, the identity of the peer reviewers, but that the peer reviewers can see who the author group is. Double-blind means neither group can see either one, so the peer reviewers can also not see the author identities. There are advantages and disadvantages to both. The double-blind theoretically leads to less bias in reviews, but surgery is kind of a small world, and so it gets a little tricky because you are highly likely to know one of the authors or to have collaborated with one of the authors, and if you don't know who the authors are because you're blinded to it, you may inadvertently agree to a paper that you kind of realize as you're reading it, oh, I think I know who did this, and this is a colleague of mine in my institution or something, and it can lead to other kinds of bias problems. So one is not better than the other, I don't think, but certainly journals are experimenting with which to do. And I think a lot of journals are starting to move towards that double-blinded strategy. So in general, the review process is intended to let the editors know what they need to know. Obviously, the editors are reading these papers, but to be honest, for every one paper that you see as a reviewer, an associate editor is probably seeing 20. And so we are managing a very large volume of manuscripts, and we try our best to appropriately review them ourselves as well, of course. But sometimes when you're managing that many papers, you really rely on the reviewers to be this sort of more detailed and nuanced critical eye to help you focus your own ability to understand if this manuscript is appropriate for the journal or has major limitations. So this includes making sure that everyone's clear about what the manuscript is about. That may sound a little silly, but sometimes the title and then the aim and then the study design do not all align. So it's important to make sure that whatever the authors are pitching in their manuscript comes across to everybody in the same manner, and that there are not mixed messages coming from the manuscript. Is it scientifically valid, of course, and we'll go through some methodologic considerations. Does it meaningfully advance clinical care or scientific knowledge? So a lot of times we'll get papers that are really nice, but they've been published essentially 10 times before, and there's no new or innovative aspect to the paper. And so that can become important in determining whether or not it can or should be published. And then will it be cited? This is important to journals because journals are judged by several metrics, but one of them is impact factor, which I'm sure many of you have heard of. The impact factor is this equation of citations within a given year overall for a journal. And that is divided by the publication number from the year prior and then the publication number from 2 years prior. So the number of publications and the number of citations matter, which is why journals can't or don't just publish any and every paper, because that actually can negatively impact their impact factor. So they want to pick or select, a somewhat limited number of articles that they think are each going to be highly cited to really increase their impact factor. When you get invited to review, you are going to receive an email that looks something like this. This is one, as you can see, that I received from Journal of Vascular Surgery, but they all look pretty similar because they all come, not all, but most come from something called Editorial Manager, which is a widely used sort of platform for reviewing papers and handling papers at most journals. But you'll get this email, and the content of the email is different from journal to journal. That may, to some degree, depend on how blinded they are. But so some journals do this, like JVS does, where they just give you the title and the authors pretty much, and then say, can you please consider reviewing this? And then you've got a link to accept the review or decline the review. Other journals, especially the double-blinded ones, will give you just the abstract and title. Then at least you can look at the abstract and kind of determine if that's an area of expertise for you or something that you feel like you can adequately review. I would say if you decline a review, try to suggest another reviewer that would have the expertise to review that paper, because it's really hard for us as editors to find reviewers. So anytime you can suggest another reviewer if you are declining, it's really, really thoughtful and helpful to us. So this is a checklist, a table. It comes from a paper that I wrote with my Review Academy participants. So I'll show you the paper later, but I find it very helpful. This is kind of what I have them use when they're learning how to review. So I find this very helpful, especially when you're getting started. It sometimes can feel like you may not have a lot to say, but if you use a systematic way of reviewing, you will find that there are actually things that you can consider in every single manuscript, just looking at this table, that can help improve the quality of the manuscript. So first of all, before you start and before you agree to do the review, ask yourself, do you actually have sufficient knowledge on the topic to provide a critical appraisal of the manuscript? I would say that if you're getting asked to review something, the editor has already decided that there's some perspective that they want from you. Maybe you're getting asked to review something that's not in your wheelhouse, so to speak, but maybe you have published a paper using the same statistical analysis that this paper uses, or maybe the patient population is not generalizable, but is a patient population that you specifically have expertise with, even if the pathology is not. So I would say most of the time, if someone's sending you a manuscript, they've probably already considered if they think you're appropriate or not. And so just trust that there's some aspect they really want your opinion on. Can you meet the review deadline? Every journal is different. Most have a 2-week deadline for the review. And so obviously you don't want to agree if you can't meet that deadline. Journal metrics, manuscripts, and so forth. So that's why it is very important to be able to meet those deadlines for the journal editors. And then obviously, do you have any conflicts of interest that would prevent you from giving an unbiased review? Sometimes that is you have former co-authors that are authors of this paper or at your institution. It's really hard in surgery because you know a lot of people, it's a small world. So I know I have one colleague that her rule is if I've written a paper with one of the authors, I shouldn't review it. I would say in my specialty, I would be having to turn down almost everything still because it's such a small world. So I kind of say like, if it's someone who's a regular collaborator of mine, I'm not going to review it. But if it's someone who's a middle author and I've published like 1 or 2 papers with, and I don't know anything about this study that they did, I might agree to review it. But again, I have to really consider, am I going to be unbiased when I provide that review? You also may receive a request to review something that is a topic of your expertise that you have sort of an opposite opinion on the authors, and you may find it hard to review that paper in an unbiased manner because of your own personal beliefs on the topic. And so that's something to consider as well. Once you agree to the review, let's assume you've said, I can do this in time, I'm not biased, and I have the expertise. Once you agree to review, you will go to your editorial manager page, and they all pretty much look the same. There's a main menu, and it will show you any pending invitations, any pending assignments, and any completed assignments, and you can click on those links and see your work. The completed assignments part is helpful. And I may talk about this later, but that's helpful because once a paper has been fully reviewed, you can actually click on those papers that you reviewed and see what the other reviewers said as well. And I find that to be a wonderful learning process for me as a reviewer. Sometimes people will bring up things that I didn't think about, and I learn a lot from that. Or sometimes they think completely the opposite of me as on a paper. And so it's good to know, when I'm aligned with what other reviewers are seeing and not. As you review, make sure you're providing actionable feedback to the authors. So this may sound obvious, but your purpose as a reviewer is not to just go in there and rip the paper apart. It's to provide feedback that the authors can actually apply to their paper and make it better. So everything you say should be something that they can apply and make better. Even if it is a critique, it can be said in a way that's not, well, your analysis was terrible. It can say, why did you do this in your analysis instead of this? And might you consider going back and excluding these patients for this reason? That will actually potentially make their paper better. Hold on, I think I missed something here. I don't know if this comes up in a minute and if I just accidentally boxed it out here, but the other thing under considerations are ethical considerations. I have seen a couple papers as a reviewer that are analyzing, for example, a device, and the authors have ownership or are known consultants for the device company and have not disclosed that. Or there's funding for the paper that has not been disclosed that's related to the device. And these types of things are things that you as a reviewer can be very helpful in catching and making sure it's okay if someone wants to publish a paper on a device that they have ownership in or consult for, but they really need to disclose that. And that needs to be apparent to everyone reading the paper so that they can take those results sort of with a grain of salt, potentially, in those situations. So just in terms of providing the feedback, I wanted to show this example because this is why it's really, really important to provide constructive feedback. So this is a paper that this is not the same paper I showed you the invite for before, but this is a paper that as you can see on the top of the bigger box, recommended reject for. A lot of these will ask you to put a score down of 0 to 100, and they usually have like a scale for what the different point range is mean, but I scored it as a 40 based on this journal scale. I put this journal has a lot of required questions you have to put. Not every journal does that, but the comments to the editor, we'll talk about what that usually looks like in a minute, but I put just a couple lines to the editor. And then my comments to the author, I had 9 comments. They're pretty detailed. They're, as you can see, professional. They're all asking meaningful questions. They're not just bashing on the paper. Reviewer number 1 gave the exact same recommendation as I did, the exact same score, but as you can see, they gave no comments to the author. This is really problematic for 2 reasons. One, because this editor probably now had to go make a decision of reject on this paper. But if every reviewer just said reject and didn't give comments, it's hard for the editor to justify why they are rejecting your manuscript. So you really want to give those productive comments, even if you think, well, I'm not going to ask for a revision anyway, what's the point? It's helpful for the editor to be able to show the authors exactly why the reviewers felt this was not appropriate for publication for this journal. Also, these authors are probably going to turn around and submit this paper to some other journal, and you want to help them get their work published. So if you don't give them any feedback that's constructive, they're not going to be able to make their paper better, and they're just going to be submitting it in the exact same way to some other journal and potentially getting the same result. So it's really helpful to give constructive criticism, even if you think this is not a paper that's going to be considered for publication. We talked about ethical considerations. Okay, so now you've sort of done the background work of, okay, I'm considering I'm going to do this. I've done the baseline considerations. How am I going to approach my review? There are different strategies. Some people go through the paper multiple times, and some people just want to read the paper once and do it in great detail and write their review based off of that. My approach still, and especially when I was first learning to review, is I read the paper once through just without thinking much about the review process. I just want to understand what the authors did, what their analysis was, what their interpretation of their results was, and how they're putting that into context. Then I go through a second time and really look at it in detail and write down my reviewer comments. I find this helpful largely because a lot of times you'll be reading and you'll think script. And so then when you're actually sitting down to write your comments, you kind of know. I admit, I will often, now that I'm more experienced with review, I will often like jot down some notes that first time through that are not in any like formal way, but just notes to myself of like, they probably need to address this, kind of bullet point notes. And then I'll go through that second time in detail and just really write out how I want to say that to the author. The way that you list your reviewer comments does depend on the journal. Each journal will sort of give you a template for their preference, but I would say most journals accept 2 ways of listing comments, and I personally just do it the same for every journal because I don't think people care that much as long as it's organized. Those 2 ways are, and again, I'll show you examples of this momentarily, but the 2 ways are basically you can either put your major comments, then your minor comments, or you can do all your comments in order of the manuscript and put a star next to any comment that is a major comment. And we'll talk about what that means in terms of major and minor as well. But I would say if you can stick to the journal template, just figure out what their journal preferences are before you start writing your review. It makes your life easier. All right, so then you're going to systematically go through the paper and think about each of these sections. One thing I wish we would have put in this table that we didn't is the title. To be honest with you, I would say probably 20 or 30% of the time, I'll review a paper that the title doesn't actually match what the key findings were. I don't know if that's because people sort of evolve what their analysis is and the way they interpret it or what, but there are a lot of times where the title needs edited. And so look at the title, make sure that matches the conclusions that the authors came to. Then the abstract is also another place where reviewers can easily skim through that and not think much of it, but actually there's a lot of information there that's really important that you can comment. They will present that data and then they'll go through and do a more refined analysis before they write the manuscript and submit it based on the feedback they got at that conference presentation. And it is so common that they will then copy and paste their original abstract from the conference into this abstract section, and it doesn't necessarily match what their final analysis and numbers were. So it's important to make sure that everything's consistent between the abstract and manuscript. I personally, the other important thing about abstracts is sometimes this is, we as the readers, we see a paper, we click on it, we read the abstract, and we decide from the abstract if we want to read the whole paper or not. So it's important that the key information is there, that it grabs your attention. Why is this important or novel? Are the key findings or the key information from the methods in the paper? So what was the patient population? When was the study done? And what kind of analysis was done should all be there. Then are the key results there, and can you actually interpret them? I will sometimes see abstracts that use all these abbreviations or list results that they don't explain where those results came from in the abstract because there's such limited word count there. So make sure that you can actually understand and interpret what the results are in that abstract form. And then is the conclusion in the abstract overreaching? I see this all the time. The conclusion in both the abstract and the paper are sometimes overreaching. For example, many times people will say, let's say we're studying the association of smoking and wound infection rates postoperatively. People may draw the conclusion that smoking causes wound infection rates postoperatively, when actually their study design analysis just shows an association. It doesn't show that smoking causes it. So you have to make sure that people are making the right conclusions and they're not overreaching. And then finally, a lot of times people will submit abstracts that are like 600 words when the journal has a 350 word limit. That should be caught by the editorial team before it gets to you, but it's not always. So just make sure that the abstract meets the journal requirements listed on the journal page, which should be under like an author submission tab. The introduction. I personally use a very specific format for my introductions when I'm writing, and I think that's because it covers all the things that should be covered in an introduction. And this is not the only way to do it, but this is my personal preference. And so think about these three things when you as a reviewer are looking at an introduction. So I use the problem gap hook method of writing, and this covers these things that you need to see in the introduction. So what is the relevance of the paper? Why is this topic important? What do we already know about this topic? What has already been published about it? And then why does whatever we're studying here add to that existing literature? Additionally, there should be an aim stated at the end of the introduction, and that aim should align with whatever the study design is. Many times people will say that they aim to study XYZ, and then their study design is like something entirely different, and then their conclusions are something entirely unrelated. So just make sure that everything is in alignment. In terms of methods, this is definitely the most intimidating part of a peer review for most people. And I think there's, even if you don't have background of a master's degree in epidemiology or something, you don't feel like you know a methodology at some granular level or statistical analyses at some granular level, you can say a lot about the methods even with a basic fund of knowledge. So first of all, is there an appropriate institutional review board or whatever your ethical board is in your country? Is there an appropriate statement saying that this paper, this study, was approved by that ethical board? Is there a statement referring to use of the appropriate reporting guidelines for that methodology? And I'll show you a table of what that looks like in a moment. Is the study population appropriate for what you're studying? Is it generalizable? Were the right patients included or excluded? And are the appropriate statistical analyses used? Now, you may not know the answer to that if you don't have a big statistics background. I will say, especially for more complex analyses, it is completely okay to tell the editor that you do not feel like you can review that specific item and that you would recommend a statistical reviewer to look at this paper. We have, all of our journals have statistical reviewers that will review papers specifically just for the analysis part to make sure the analysis is appropriately done. And if you don't feel comfortable, you feel like this is out of your league, it's totally okay to ask the editor and your comments to the editor for a statistical analysis review. Again, this is what both of these tables I'm using are from this paper, but this is a really nice table that shows you all these different study designs, what the biggest strengths and weaknesses are of the study designs, and then what appropriate reporting guidelines are out there for these study designs. And this can be really helpful if you don't feel comfortable with all these study designs to just look at and say, okay, well, I know for cohort studies, okay, these are the typical strengths and weaknesses. So let me see if the authors address those things in some way. And then you can see the guideline or checklist associated and addressed all those things. These guidelines and checklists or reporting guidelines that say, hey, if you're going to do this kind of list, to make sure you address all these things in your study design. So nobody expects a reviewer to have all these memorized. You can go to this website or the websites in the table in the slide prior and see what these guidelines or checklists are and peer review. Next are going to be results. So are the results well organized? I can't tell you how many times I will be reading the results section and suddenly there's new analysis that they didn't mention in the methods section. They'll say, we found this, so then we decided we were going to do XYZ analysis and we blah, 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 and then we found this. The methods should be all in the methods section. The results should be all in the results section, and you really want to make sure that that is well organized. The other problem that some authors have with results sections are they either list every single result, every single number you can imagine, even stuff that isn't really relevant or in the big picture of the findings. And it can become overwhelming of just paragraphs of numbers. And you can't, as the reader, you end up kind of absorbing none of it. Or alternatively, the results will say, for the first analysis, we found the results in table 1. And then it's a reference to table 1. And there's no writing about those results. So there needs to be a balance. The author should present the most important results in writing in the manuscript, even if it's in a table, but they shouldn't list all the results in the table. The table is really for that nuance, like this is every single finding we got. And then the manuscript is to highlight the important findings out of that. So try to help the authors determine what that is and make sure that you're interpreting what they want you to interpret. The other thing that reviewers just kind of like blow through a lot of times, and you can be really helpful as a peer reviewer with, are the tables and figures. Almost always there will be a table or figure that is unclear. Either it's marked in a way that you can't understand what they're trying to say, there's a missing legend, or the legend says things in it that don't match what the findings are. Or I will regularly see that something in a table doesn't match what is presented in the results, like the numbers are different or the significance is different. So you really want to make sure that those tables and figures match what the authors are presenting in the results and that you can interpret them. This is, again, another easy way to comment to authors in a way that can be helpful to improving their manuscript. And then the discussion. So the discussion ideally should start with a paragraph about the most important findings from the paper. And then usually we'll have about 3 paragraphs of how the authors interpret these findings in the context of the current literature or what's currently clinically relevant. So sometimes authors will just jump right into the actual discussion part and not re-summarize their findings. I think it's important to have sort of that short paragraph that sort of summarizes the big picture findings, then a few paragraphs on how they interpret this. Maybe other papers found the opposite finding. Why do the authors feel that they found the findings that they did? Or what does this add that other papers have not, or other studies have not looked at? There should be a limitations paragraph. A lot of times in the initial manuscript, especially, authors will be a little bit coy about their limitations because they don't want to point out their limitations, and that's kind of fair, but they do need to point out the limitations. So this is your opportunity as a reviewer to say, hey, you really need to add a limitations paragraph or add something to your limitations paragraph. This is an important limitation of your study and it needs to be acknowledged. It can just be a sentence, but it does need to be acknowledged. And then finally, there will be a conclusion at the end of this discussion. And again, the conclusion is very important. You really want to make sure the conclusion matches the actual results from this study and that it is not overreaching and that it is stating very, flatly what the findings are and how you can interpret those findings. I kind of already said that. The bibliography is another place that a lot of reviewers kind of overlook and can be useful. You want to make sure not only that it's in the right format, but that the authors included all the sort of important studies on this topic, and alternatively didn't go overboard. They don't need 100 citations, but they just need to make sure the key findings, especially if there are some landmark studies on this topic, are included. And then the other thing I've seen, I think twice now, I've reviewed papers where the authors literally every single citation was just their own paper. You are the expert in this topic and the person who has published a lot on this, but you need to have well-rounded and unbiased references as well. So if there's a paper that has 25 citations from the senior author, there should probably be a balance of some other citations from other groups as well. And that's okay to point out to the authors. Then your final task as a reviewer is going to be to take those comments that you've created based on your sort of systematic review of this paper and upload them to Editorial Manager, along with some comments to the editor that will be private and only seen by the editor and not the authors, and a recommendation to the editor. You never want to put your recommendation in your comments to the authors. Your recommendation is not what the editor has to recommend, and it may not match what the other authors recommend. So you don't want to say, I'm going to recommend your paper for acceptance, and then the other two reviewers said that they're going to recommend reject, and the editor ends up rejecting it, because that puts the editor in a tough situation. Admittedly, we can edit your comments, and so sometimes I will edit those out if I'm the editor and it doesn't match what I'm ultimately recommending based on all of the reviews. But just leave that out of your comments to the authors and put it only in the comments to the editors. Again, I mentioned this earlier, but these are sort of the two formats that you're going to put those comments in. You're either going to list all your comments in order of the manuscript and put an asterisk next to the things that you think are major comments, or you're going to do major comments and minor comments. This summary idea, if any of you have written a paper, you may have seen this, where the reviewer writes a little summary of what they read and says, like, this was an excellent paper about blah, 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 blah. Here are a few comments. I personally never do a summary, and this is because I'm all about efficiency, and I, as the author, don't get much from rereading a summary of my paper. That's not going to help me unless people are completely interpreting the wrong thing. That is the one case in which maybe a summary would help, but I've already read my paper. I don't need a summary of it, and you don't need to spend time giving me a summary of it. And I think a lot of editors feel the same way. However, if you want to write a summary, it's totally fine to do so. Some reviewers have told me they like writing a summary because they may be reviewing multiple things at once, and just having that summary helps them make sure that they're looking at the right comments, they're uploading the right comments to the right paper, and that they're not, it's sort of their way of organizing something. But this summary would be just a few sentences on what you got out of the paper, how you interpreted the author's findings, and then maybe saying something like, this was a lovely paper about whatever. This is an example of, this was one of my borrowed slides, as you can tell, but this is an example of what somebody might put for a summary before their reviewer comments. And then the reviewer comments, I keep mentioning this major and minor. Really what that means is a major comment is anything that you as a reviewer think has to be addressed for that paper to be considered for publication. And a minor comment is anything that you think would make the paper better, but that it's not critical to be addressed to go forward with publication ultimately after a revision. But these slides give you some helpful information to what things might typically fall in that sort of major versus minor category. So obviously, if there are major problems with the study design, there are errors in the statistical analysis, or the results don't match between the table and the results section, the methods are not written in a way that someone could duplicate them. So all the methods, you should always be reading the methods section and think, well, I could take the same data set and duplicate what the authors did. If you can't do that based on what they wrote, that's probably a major revision that's necessary. And again, if the conclusions are overreaching or misleading, that's a major revision. And then generalizability. So you'll see these studies where the patient population just isn't generalizable to what most of us are caring for, the patient population most of us are caring for. And that may be a major issue that the authors have to address. That being said, they've already collected the data, so they probably can't change that. So if you think that that is a major problem with the paper, you should probably be recommending reject, because the authors can't fix that for a revision. And then these are just some common, we don't have a lot of time left, so I'm gonna kind of blow through this, and you guys I can share my slides, and this is recorded, so you can kind of pause and look at this. But these are just some common problems you might see in some of these clinical studies that end up being major limitations to prevent publication. These are things that might be more minor comments, but honestly, sometimes these are major things for me. Like I said, when I had papers with all references from the senior author, to me, that had to be changed before going forward with publication. So that was a major comment. Grammar. You are not, your job is not to be an editor. So we have copyright editors at all these journals that are going to fix grammatical errors. You do not need to go through and mention every single one. Now, the one time that I will mention grammar errors is when there's maybe an incomplete sentence or a sentence that's said in a way that it's not actually getting across the point the authors were trying to make because it's grammatically incorrect or it's incomplete. I will mention those things because I do think it's important that the authors are portraying what they're trying to say in the statements. But if it's simple grammar, there's going to be a copyright editor that's looking through all this, and it's not your job as the peer reviewer to do all of that. You can do it if you want, but there are so many other more meaningful things you can add as a peer reviewer, and there are other people that are going to catch these grammar errors. Then, like I said, you are going to give your recommendation to the editor on whether you recommend accept with a minor revision. Well, let me take a step back. Every journal is different with what recommendations you can make. It's usually like a drop-down menu. I would say most of them are actually accept, minor revision, major revision, or reject. Sometimes there are more options like accept after minor revision, no re-review needed. But usually it's just accept, minor, major, or reject. And the minor and major, typically there's no acceptance or rejection implied ultimately. Usually if an editor is going to send something out for revision, they want to ultimately accept it though. So assuming the authors provide a reasonable revision, it's sort of implying that this is something that can get across the finish line to publication. Make sure you leave a comment to the editor, even if it's a line or two, that just sort of they're going to read your comments to the authors and they're going to get the idea, but it's nice to just have a line or two that says, look, this was my major concern with this and why I said reject, or this is something that they absolutely have to address, or I won't re-review the paper because there's just no point. And then telling them what you think the clinical relevance and the likelihood of this being cited can be helpful as well. When you are providing these reviews, it's, again, unless you're recommending reject, there's really no point in saying, hey, I think you need these additional analyses or this additional data to really get across the finish line to a publication, because there are certain things that the authors just can't change. They can't change certain limitations of their data set. So asking for that is unrealistic. Now saying, please mention that a limitation of your data set is XYZ and that you don't have this information, that's completely appropriate. I already said this, but don't try to be a copy editor. You don't have to edit the grammar of every single line of this. Not every manuscript needs a revision. That's okay. If you want to say, I just accept this and here are some minor comments, but honestly, they don't even need to revise this and it's in acceptable form. That is okay to say. to the editor, but also do not be afraid to recommend rejection. Again, your recommendation is just a recommendation. The editor doesn't have to do what you say. If you feel like a publication or a study is not appropriate for the journal or is not salvageable for that journal, it's okay to say reject, and they can use your recommendation or they may not. But sometimes the editors actually like when people are not hedging. I mean, I think most reviewers will ultimately say like major or minor revise because they want to hedge and they don't want to be definitive. But it's the editor's decision at the end of the day. So don't feel bad about saying that. I'm going to try to wrap it up here really quickly. I know we're running short on time. This is just an example of what your comments to the editor might look like. This was something that I think I must have, I think I was on the fence about realistically, so I left a longer comment to the editor, and then I left, several comments to the author. This is another one where I clearly rejected, and I just sort of said to the editor, look, this is a major limitation of the study. I don't think it should be published for this reason. Here's one that I rarely just flatly accept things. But here's one that was a perspective piece that I said, you should just accept it as it is. I did leave some comments, but I don't think they actually need to do any of these things if you don't want them to. I think they did end up doing a revision with these comments in mind, but it's okay to say accept if you think it's reasonable how it is. Respond to your invitation right away. Again, we as editors have metrics that we need to meet in terms of how long it takes a manuscript to get published. So if you can't do it, just tell us you can't do it. Or if you can do it, just tell us you can do it so we can get on the road with asking other reviewers if we need to, or we know that we have reviewers in place if you're able to do it. Submit your review on time, as I mentioned earlier. If you know you're not going to be able to review, I recommend there's a way in Editorial Manager where you can actually put your status on pause and say, hey, I'm going to be out of town for the next 2 weeks. Please don't ask me to review. And this is important if you're interested in getting an editorial board position, because this actually, the amount of times you agree to review compared to how many times you're invited actually counts on your stats that we look at for picking new editorial board members. So this is a little bit more advanced and nuanced, but if you really want to get on an editorial board and make your stats look good, this is important to do. I say if you're really interested in getting involved with this, just say yes to everything when you're getting started and try to do as many reviews as possible. The more you say yes, the more you're going to get asked. And eventually you're going to have to start saying no to some things. It's just not reasonable once you are someone who gets asked to review every single day. But when you're getting started, saying yes makes you a reliable person to the editors, and they're going to think about you when they're looking for someone to review next time. And that kind of helps give you momentum. And like I said earlier, always make sure you go back and read the other reviewers' comments when the processing of a paper is complete. That's where you're going to learn the most about what you could have or maybe should have said as a reviewer when you're first starting out as a reviewer. And again, just very quickly, because I want you to understand how you can become a sought-after reviewer. This is the process of how papers get reviewed or go through the editorial review process. They get submitted. I'm using the journal Surgery as an example because I'm an associate editor there, but they get submitted, they get handled and sent to an associate editor. So I handle any paper that falls under vascular, systematic reviews, or education personally, but we have associate editors for everything. I then read the papers, and there are many that I say, I know this is not going to be appropriate for the journal for whatever reason, and I make an executive decision, or recommendation, I should say, of reject. So this is called desk rejection. I am not the final say in that. That then gets triaged to Dr. Hicks and Dr. Wexner, who are the editors-in-chief, who will also read the manuscript. And if they agree with that, then it will be rejected. But they may disagree, and they may say, I actually think this should be sent for review. And in those cases, they'll send it back to me and I'll send it out for review. If it's not a desk reject, I will invite reviewers, typically 3 for the journal Surgery. We look for editorial board members, known reviewers, authors at the journal, or experts in the subject matter. When we typically have 3 reviewers, and we typically give 14 days per review at our journal, but every journal is different. When I'm looking for reviewers, this is another tip for you that are trying to get involved with peer review. One of the ways I can look is to search by classification matches. And I wanted to show the screen, probably should have deleted out the names here, sorry, but I wanted to show the screen because it shows you all the statistics that I see on the editorial side and things that we're looking at to decide, A, who we're going to ask to review, and B, who we might ask to be on the editorial board. So we see when you were last invited so that we're not overwhelming you with invites, hopefully. We see if you have any invitations pending, again, so that we're not sending you 3 invitations at once. Then we see how many times you've agreed and how many times you've declined an invitation. And the terminated means sometimes you just don't answer at all and you get uninvited. We also see, do you have reviews in progress? How many reviews have you completed? What is your average time to complete a review? So like this person on the bottom, their average days is 23 days, which is a bit long, whereas the person up here usually completes a review in 1 day. These are stats that we see when we're deciding who to invite to review and who to invite to be on editorial boards. The other thing I wanted to show you here, there is this, one of the ways we can search for reviewers is by classification matches. So as you can see here, this must have been a cardiac paper, and these people are cardiac surgeons probably, so they matched with cardiac classification. So you may regret this later, but the way that I really got involved in review and got asked a lot is I went through the classification match and I pretty much checked every checkbox. Obviously, for a surgery journal, it's different, but for like a vascular surgery journal, I can say I know something about every pathology, right? I would also click like education because I do education research and sort of everything. Sometimes classifications are like clinical outcomes or basic science research or things like that. They may not be a specific pathology, but I just go through and click anything that I possibly could review on, even if it's not that interesting to me. And that way, when people are searching for reviewers, my name tends to pop up with most of the classification matches. That's just a little tip to get invited to review, but you may then once you start getting invited a couple years down the road, regret that because you'll get invited all the time. And then on the editor side, this is what we see. We see what the 3 reviewers recommended. We can click and see their author reviews, or there's a summary down here of all the confidential comments to the editor compiled, and then all the comments to the author compiled. And then this was, I borrowed the slide from Dr. Hicks. This is when she was an associate editor. So she then makes a recommendation that at the time would have gone to Dr. Wexner, who was the editor-in-chief overseeing it, and they would have gone from there. And then again, this is just reiterating that process. So the reviewers give us our recommendation, and we as the associate editor give a recommendation and send it to the editor-in-chief who gives the final say in the recommendation. And then just one last slide here. These are ways to get started in reviewing. If you're looking for ways, if you're a trainee, find a faculty mentor. They will get asked to review a lot, and most journals don't mind if they mentor you as a trainee through a review. Reach out to editors at journals you're interested in. I will put my emails on this last slide. Please reach out to me if you want invitations to review and let me know what you want to review. There are formal courses like the Surgery Peer Review Academy that you can take. There are modules online at most publishing companies that you can go through as well that are typically free. A lot of conferences will have either workshops or panels on peer review. So that's another way to get education in this. And that's all I've got. So here's my email. If you want to review for surgery, please email me and let me know. If you're not in our editorial manager system yet, I will put you in there. And if you are, I will keep you in mind for future reviews. Or if you're interested in surgical education and have experience with that, I can put you in the Association for Surgical Education's peer review pool as well. And that's it. I know we're right at the top of the hour, but I'm happy to take any questions if anyone has questions before we log off here.
Thank you so much, Dr. Weaver. I think my comments probably resonate with the rest of the team that I think whether one is a novice reviewer or planning to review or a veteran reviewer, if I'd say it that way, the session has been quite fruitful for each and everyone. And I like the flow with which you took, whereby you took us through at least each and every stage of reviewing and just mentioning really key pertinent details. And so even as we invite questions, I just like to still pass my gratitude for the same. Thank you so much.